name is Dr. Manrina Rhode. I am a cosmetic dentist and owner of DRMR Clinic and Academy. At the British Dental Conference and Dentistry Show this year, I'm going to be talking mainly about communication. There's so many areas in dentistry where communication is important, whether it's your clinic communicating with the lab, or whether it's the clinic communicating with your patients, or whether it's the clinic communicating with the outside world, or as a dentist, us communicating. So there's lots of different portals of communication that we need to get right, and it's a big topic. My talk spans such a range of topics regarding communication. We're talking about communicating as a practice, how we communicate with labs, how we communicate as a team, how we communicate with the public. And if I had to really choose out of those which one's the most important, it's almost an impossible answer to give, because if any one of those fails at any point, everything fails. As a business, all 3 points are so important and really equally important. If you asked me where the most common breakdown of communication was within those 3, I would say, well, certain teams may have issues communicating. We certainly don't have issues communicating at DRMR. We've got that all locked in, but that takes processes to be in place to be able to nail that. Again, communication with labs can be difficult, and I really want to talk about that at the Dentistry Show. I think labs haven't necessarily always caught up in the way that our patients, for example, communicate with us. When a patient contacts the clinic, we've got different client coordinators in place to take the patients through that journey, and quite often labs don't have that, and it's something that I want to talk about, is why don't we have that? Why don't we have a coordinator that we can communicate with at the lab, that we know their name and we can contact them, and as clinicians we can make sure that we've got that direct contact. Again, I only work with labs that have that for me, that I know the team's name, that I know my lab technician's name, that I know that I can call them, WhatsApp them, email them whenever I need them. And then of course, communication with the public is an area that dentists really struggle with. They really struggle with showing up on social media and communicating what it is that they do. It's something that can be worked on and is becoming increasingly important in this day and age. And also clinicians communicating with their patients. You can be an excellent clinician and do beautiful clinical work, but then just not have the ability to be able to communicate with your patient what it is that you've done or what's going on. And that patient will never know about that beautiful DO composite that you put at the back of their mouth. All 3 are equally important, but maybe the one that I feel like maybe needs the most work within our profession might be clinicians communicating with their patients. So I've been a dentist for 24 years now. I went to dental school at 18 and I graduated at 23. So now I've been a dentist for longer than I wasn't a dentist, which is mad. And so over that time, my communication style has really evolved, and the way that I communicate with patients, as I've understood people better. We had a lecture recently in clinic where we had someone coming in talking about 4 different treatment plans for 4 different personality types, and it was so important and it was so interesting in learning as a dentist to understand that the way that you communicate with a patient has to alter depending on how that patient learns. Some patients want you to go in a lot of detail, and if you don't, then they really don't understand. Other patients, if you start going in that level of detail, they've switched off. They just want to know the facts, they want to know the basics that they need to be able to move forward. And and other patients just don't want to know the technical terms, but they just need a lot of support. And so if you can understand the personality of the person you're interacting with, just like in real life, if you want to be a master communicator, with friends and with people that you meet in real life, you need to understand who it is that you're talking to, and you can't treat everyone the same way. So certainly over the years, I've learned that. I've learned how to read people better and to understand people better, so that they can understand what it is that I'm trying to tell them. Communication between a dentist and a technician is one of the most overlooked things in dentistry. The more I teach and the more I speak to dentists, and a dentist will come to me with a problem with, for example, an anterior veneer or an anterior crown that their lab can't seem to get the colour quite right for them. And then, once I start going into detail, well, how did you communicate with the lab? Did you send a photo of what the tooth looked like when it was prepped? Oh no, I didn't have time to do that. Okay. what do you mean you didn't have time? That was a really important part of your process. So part of it comes from us as dentists. You know, we really need to learn how important the technician is in the work that we're doing. They're half of the work that we're doing. You know, you can be the most clinically beautiful dentist, do the most beautiful prep, but if you've not communicated what you've done to the lab, you've not done a good impression, you've not sent photos, you've not sent shades, you've not decided the final shape and communicated that with the lab, then your work's not going to be good enough. So we need to learn to be better at that and have protocols in place, non-negotiable protocols in place. But equally, from the lab's end, there are far too many labs out there where you just send your work off and it goes to a lab and you don't really know who it is that's making your work, and it could be a different person every time. And how are you going to create a relationship? We all know that in all areas of life, the more you work with a single person, the more you get to know each other, the more you understand each other's style, and actually the better your work becomes. And so really we want to be creating personal relationships with our lab technicians. We want to know them by name. We want to make sure we're communicating with them directly. From the lab's perspective as well, you know, if they could encourage that and allow that to happen, again, through my teaching, you know, I'll speak to dentists and they said, oh, I've tried that and they can't tell me which technician it is that will be doing my work. And you know, my answer is, well, stop working with that lab then. You know, that's never going to work out very well for you. Also, the organizational aspect of labs, you know, sometimes labs are still, I think, behind in the way that they're organizing themselves. I've been into labs before where they've still got boxes on the walls and paperwork. You know, they're really not computerized like we all have in dental practice, going away from paper notes onto using different patient management systems. And so they're not as organized either. They've missed deadlines for when things need to be sent back, or you'll contact the lab and they'll be like, oh, we missed that bit of work. And so the labs need to up their game as well and organize themselves just like we've had to do in dental practice. I'll use an example of the kind of labs that we work with. We have such great relationships with them. I'll be able to pick up the phone any time of day or night. You know, I've had labs that I'm messaging them. As dentists, often we're not free until quite late at night. I'll pick up my phone and be WhatsApping my lab technician. You know, we're both equally passionate about the case that we're doing, and we're messaging and they're sending me exocads for me to have a look at. And I don't expect that from my lab. I don't need them to be working in the hours that I'm working. But sometimes you come across someone who's just as passionate as you, and that's really exciting. And equally, the labs that we work with, we know that if we've sent work to them, we've given them the return date, we know it's gonna be back. We have protocols in place to make sure that lab work's here, but I can't think of a single time when it's not been here on time. When you work with a good lab, it's like music. So I started my journey with social media probably in 2011, and we're in 2026 now, so 15 years worth of being online, and ChatGPT loves me for it. ChatGPT is my new best friend because it keeps referring patients to me, and I think it's because there's so much content on me out there that when people are going online and asking questions, ChatGPT will grab something that I've said and be like, oh, you need to go and see Dr. Manrina Rhode. And so loving AI at the moment. The journey's been incredible. The question that I'm very often asked in podcasts or in interviews is, if you could go back to yourself 20 years ago, what would you tell them and what changes would you make? And quite often the answer is, there's going to be this social media revolution and you won't know that it's coming, and when it comes you're going to really enjoy it because it's part of your essence to enjoy posting online and sharing photos and then sharing videos, and you do really well out of it. I built my business off my social media presence and the patients that it attracts from all over the world. But what I always say is, double down on it. I wish if I could go back to the beginning when I started. Yeah, it's been so great for me. I did so much of it. Why didn't I do even more? The only thing I would think about my social media journey is it's been absolutely brilliant, and yeah, the more I do, the better it is. And that's what I teach. I'm always like, don't worry about perfection, just consistency over perfection. Just keep getting it out there. Just keep getting the content out there. Dentists get far too much in their head about being perfect all the time. And I think sometimes that can hold us back. There's a lot of hesitation within our profession from dentists about showing up online, and I think part of that is our naturally perfectionist personality. I feel like dentistry chooses that sort of personality type where we really worry about the smallest things and we want things to be so perfect all the time. The thing with social media is you need to understand is it's not that big a deal. Like, definitely don't go on there and be negative. That's not what social media is for, in my opinion. But if you're going on there and you're sharing your life, or you're sharing your work, or you're sharing positivity, then you can't really go wrong with it. If you find that you're posting something and there's people out there that don't like it, then they're not your tribe and you don't want them following you anyway. And actually it's so easy for them to unfollow you, or it's so easy for you to block them. And even for yourself, if you put content out there and then a few days later you think, oh, didn't really want to do that, you can archive it, you can delete it, and then it disappears. As much as I don't believe that we should be on there sharing every aspect of our lives, if you go and if you're being authentic, then you will attract your own tribe, and really there's no harm in it. It's definitely a skill set that needs to be learned. I think for the majority of people it's not comfortable picking up a camera and speaking to it, but the more you do it, it's muscle memory, so the more you do it, the easier it becomes. And in the day and age that we live, you really can't escape it. So pick up your phone like you're FaceTiming a friend and talk to that camera, and there you go, that's your content. I guess the message that I want the dental profession as a whole, so we're talking dentists, therapists, hygienists, dental practice owners, practice managers, anyone within our industry who comes to listen to us at the Dentistry show. What I want them to take away from it is how important communication is in every aspect of our profession. As much as we may want to hide away in a corner and as a clinician do our clinical work, or as someone who works within a dental practice in our office and get on with the bits and bobs that we need to do, if we're not able to communicate what it is that we're doing, then you're really just not going to get anywhere. So whether it's in your comfort zone or not, communication is a skill that has to be learned within our profession, and the better you get at it, the more you'll enjoy what you're doing, and actually the more you'll reap the rewards of that communication skill that you've learned. Everything's so online these days. If you want to communicate with someone, you send a WhatsApp rather than calling them. If you want to see someone, no one's got time in their diary to make plans to actually see them, and when the plan actually comes about, you're like, oh, why did I make a plan? We've become so insular in how we are as people, not even as a profession. But when you do meet in person, when you do make that effort to go out for a dinner, or in this case you go to one of these shows and you actually see your colleagues, you go and watch a live presentation, you get to touch and feel the new products that are available in the market. It's a completely different sensory experience, and it's never one that you regret. It's always one that you come away from thinking, oh, I'm really glad that I went there today and that happened. So I think as we evolve through this transition that life seems to be going through, these face-to-face contact opportunities will become more and more important and more valuable for us. So these are just another example of that. It's important. I guess what I'm really looking forward to about the show is meeting up with my colleagues, having a look at what new innovations are out there on the stands, and also hearing some really great speakers speak about what they're doing for our profession at the moment.